Hi, I'm Dr. Kaplan. I'm here with Martha, and we're here at Osteopathic Wellness Medicine in Buffalo. And we're going to talk about Martha's experience with PRP and stem cell for her arthritic knee. So Martha, thanks for doing this for us. I really appreciate it.
No problem at all.
So
You've been a miracle worker.
So I know that you've had knee problems for quite a while. You
Yes.
came to me with a really bad swollen knee. Why don't you tell me a little bit what kind of trouble you were having before you started seeing me?
Okay. Many years ago, I had a knee replacement, and that wasn't going so well. And then I tripped and I fell again. But the knee bulged up, and I went to numerous doctors, but nobody seemed to help me. But then when I came to you, you noticed that there was like liquid on my knee, so you took that off. And then we just started different treatments. And as we've gone along, each time it's gotten better and better. But the thing that really did the trick was the stem cells.
Okay, so just list very briefly what kind of difficulties you were having as far as motions and activities with the knee.
Well, in the beginning, I could hardly even walk. I was actually using two canes, and then once I started seeing you, it started to get a little better. It would go back, and then as we progressed, each time it got a little better and a little better.
Okay. And you were explaining to me that the knee would shift and click.
Yes, constantly.
Constantly, and you would hear this popping noise, and it would be the sharp pain that would follow it.
The pain was sort of, it would go up and down the knee, and it was like a sciatica because it would be very sharp.
Difficulty going up and downstairs.
Yes.
Difficulty putting weight on the leg when you got up off the chair or bed.
Right.
Difficulty straightening your leg when you were in bed.
Yes.
What would happen when you try to straighten your leg in bed?
It would click, and it would just get really. It would be very difficult for me to even lay down.
Lay down. It was
Right.
kind of spasm. The
Yes,
back of the knee
definitely,
would spasm.
yeah.
Okay. So then after this, so we did several PRP injections, and then we did a stem cell injection. And the stem cell injection was about 3 weeks ago.
Correct,
or so.
yes.
So tell me the change that you've experienced after the stem cell treatment.
When I got home, the swelling was not bad at all. I just had to use the I call them the frozen peas. And I put one on the front and on the back, and then I just wrapped it up and I went to bed. The swelling then went down, and then it just seemed like my knee, actually, as I said earlier, my knee felt like it was much bigger. But in the way that I mean bigger, it just felt like it was much more solid. And when I stepped down, I felt a lot more secure. And each day it seems to get a little, better. Every once in a while there'd be a little setback, but that's because I'm walking wrong, or I might be outside and I stepped wrong, and then I'll just get a shooting pain. But then I'll get off of it for 5 minutes, and I'm right back to normal.
Awesome. So now here's an example of how natural treatments to use the body's own stem cells and platelets can really recover a knee that otherwise a doctor would be recommending a knee replacement for. So thanks for joining us at OWM Buffalo, and thank you, Martha, for being a great patient. Thank you.